So if you're getting some back pain that's maybe not really low here, but more a little bit higher up because you've been carrying your newborn baby, then this is going to be the video for you. Hi, my name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications, and we help put the pieces of the puzzle together. We often say where the side of the pain is often not where the source of the problem is coming from. And in this case, that is very true. So we had a client that came in and she was getting a lot of back pain and even like pain up into the neck, and it was all from carrying her baby. And so I thought this would be a great video to show because we can show you a simple exercise if you stay to the end, what you can do to solve this problem. Now, let's go into kind of the mechanics of what happens. When we tend to carry kids, we always carry them on like one side. And when we carry them on one side, we really round out through here and we have a lot of weight. And this is not something that we normally do. Like, you know, when the kids are grown, we aren't carrying them. Before the kids were here, we weren't carrying them. But now all of a sudden we're adding this force and we're holding them for hours, potentially holding the baby in this rounded position. And so what it did was she would say, I get burning pain in my back, like low in my back. And I'm like, point to where it is. And she pointed here. And I'm like, oh, it wasn't low here. It was here. Now, it does refer down a little bit, but it's coming from those lower ribs. And that's what we have to solve is when that happens and we're always rounding this way, those ribs in the back get rounded like this. And so that one side gets kind of more rounded this way, and then those muscles will tense up and protect. So you can do all the massage that you want to do, but it's not going to solve the problem because the muscles will tense right back up again after you get a massage because you're not fixing the problem. Very, very, very common. We see this all the time. They go and get a massage and it works for like maybe an hour, and then the pain comes back within hours or a day or so, and like, oh my gosh, I got to go get another massage. No, you are not solving the problem. And the problem is that these ribs don't move. So if you understand the mechanics is that you're a little bit more flexed and you're rotated. You know, the best way to solve these things, it's kind of like if I pull my finger back like this on the joint, you're moving material or potentially making the joint want to be more in a position like this that makes it hard for us to move in the opposite direction. So if you think of a joint, you know, when we're looking at people and trying to put the pieces of the puzzle together, we're trying to see like, what do you do repeatedly? And we've got to take the body in the opposite direction because that's how the joint will work. So very common with like your finger, if we're always moving this way, we want to move the other direction to unlock the joint because there's joint material, there's things that happens that can kind of get displaced that makes it hard for us to move in a lot of different positions. But if we know the repetitive position that we're doing all the time, then we know, okay, that's where we want to start. And so when we start asking questions or understanding what they do throughout their daily life, which a lot of healthcare providers don't do, then it gives us a lot of pieces or answers that we can start putting those pieces of the puzzle together. So this is the exercise that I showed her. So of course, doing a lot of manual work, we do a lot of manual work here, that is going to get you there so much faster. So if you notice that, gosh, this is helping, but I want to get there faster, make sure, just reach out to us and we can get you in, do an evaluation and give you an idea of like, okay, yeah, we're going to do some manual work here. And this is specifically what's going to work for you. But again, this is a great starting place for you. So you're going to use a foam roller. And what we're going to do, and like I said, when we're holding the baby, we're more flexed forward and rotated because we're holding the kid kind of like this. Our hip will kind of jut out a little bit just to compensate to help, you know, put the weight through there. So there also can be a hip component that we have to address. But right now we're only going to address this component that's in that lower part of the ribs, mid-back, lower to mid-back type area. So you're going to use a foam roller. And what we're going to do is, again, because we're flexed and kind of rotated, we're going to rotate the other direction and extend. And that's what we're going to do to kind of help unlock those ribs. And it hurts. It does not feel great at first, but eventually it's like, this feels so good. So this is what we're going to show you. You're not going to be rolling like you're rolling a muscle out. You're literally going to have your the foam roller, kind of where the lower part of the ribs are, you'll start feeling it because you're like, oh yeah, that's it. You're going to know you're there. If you don't feel it, then just kind of roll a little bit to kind of find the spot. You're like, oh yeah, that's a little tight there. You're going to have your hands behind your head and you're going to rotate and extend. So we're rotating the opposite direction and then we're extending backwards to just kind of stretch those joints. And then you're just going to breathe and hang out there. So what we find is that when you can add force like this and you hold that position, that holding of the position helps us add force to the joint. So it can have a very similar effect to a manipulation, but you're able to do it. And if you do it, 2-3 times throughout the day, you're going to notice that this is going to start improving. If it's too much, doing this with the foam roller because you're so tight and you're like, I barely can breathe, I'm hurting, my body is tensing up, then you need to take a towel, roll it up, and start with the towel and doing that, and then work your way up to the foam roller. But this, again, it's great. We're taking the body in the opposite direction. We're flexed and we're kind of flexed and rotated when we're holding the baby. So we want to rotate the opposite direction and extend. And you do it again by foam roller, hands behind the head, find the spot, rotate and extend. And if you want to find other spots, you can take your legs and you can roll. So you see how I can roll this way or I can kind of roll this way? You'll find another spot and you'll be like, oh gosh, it's not just one area, it's several areas. And you'll just hang out there and just breathe as you just kind of extend backwards as you rotate a little bit more. Hang out there 30 seconds to a minute. Do it 3 to 4 times throughout the day, and this should start making you feel better. If you're holding the baby for a while, go and do this immediately afterwards so that you can offset that motion to, again, continue to make you feel better. So if you like what we're sharing with you today, make sure you subscribe to our channel because we're always putting content out and just trying to help you understand the body better, connecting the dots, because it's not just doing a strengthening exercise here or a flexibility exercise here. We have a specific process where you really need to start with mobility first. Once we get everything moving, the joints moving, muscle tightness that might be created or shortened because the joint's been like that for a while, then we get into stability, which is more of the strengthening phase of it. Then we get into function and return back to everything that you want to do. But if you miss those steps, you're going to miss a piece of the puzzle. And that's why people just are like, it's not working. I can't figure this out. Maybe I do need surgery, or I have to just live with this for the rest of my life. I'm here to tell you, you don't. So continue to subscribe to our channel as we put out content, and ask questions. If there's anything that you want to learn, put it in the comment section, and we will be sure to make a video for you there, as well as there's other videos in the description on back pain to help you be a more educated consumer.